headquarters of common sense.
Talk Radio.
Just in case you haven't heard already, Dr. Renee Hoenderkamp is in the studio. Call Dr. Renee on 0344 499 1000 with any of your personal health issues or health issues that might be of a friend or of a loved one. Anybody, just give us a call. Or you might want to discuss medical matters generally. You might be worried about the vaccines. You might want to talk about the NHS, the kind of service you're getting from your GP. Dr. Renee gives great service as a GP. Many don't, let's be honest here. So that problem continues. So please call us 0344 499 1000, or if you're shy, you can text us, write talk at the beginning of your message and send it to 87222, or you can tweet us at Talk Radio. So welcome, Renee. Before we get to the calls, there's a few issues that I think we should discuss. First of all, let's talk about what you might call vaccine intolerance and Sajid Javid and his continued flip-flopping on this business of whether or not he's going to sack unvaccinated staff, NHS staff. He says there's 77,000 of them. Other estimates are that there may be as many as 90,000. So we can't afford to lose that many staff for a kick-off. But it does sort of play into intolerance of the 6 million people in this country who've decided not to get vaccinated. Across the pond in America, that kind of intolerance is even worse. So what do you think's going on? Why are people quite so energised against people who've made the perfectly legal decision not to be vaccinated?
I think it's fascinating, Kevin, and I think that we've been seeing this build for a long time. And I think, to be fair, the media have played into this because the way that they have encouraged people to actually feel about these people that have made this choice has actually allowed them to demonstrate this discrimination. And let's face it, it is discrimination because we are segregating a group of society because of a decision that they've made, their own medical history, and actually really pushing them aside. And in some parts of the world, people are under house arrest more or less because of that decision. And I was thinking about it today, as I said to you in the break. Imagine someone said to you, you are not allowed to work in the NHS, or you are not allowed to go to America if you have HIV, or you are black, or you are disabled. I mean, I wouldn't be sitting here now for another second if I said that. But suddenly, after spending decades getting rid of this kind of discrimination, we've now decided that some discrimination is okay. And we're going to terrorise our NHS workers because that's what we've been doing mentally to the ones that have made this decision, because they don't want to inject something into their body, because that's what we're talking about. And we are just trying to bully them to a place where they will have the vaccine. I've never believed that they will do it, as you know. I don't believe now they will do it. And I think Sajid Javid is making noises to make sure that he can now wriggle out of it because Omicron is milder and it's a different disease. But actually, he needs to wriggle out of it because it's totally morally abhorrent and he shouldn't do it. And as you know, I've been involved with the Together Declaration, NHS 100,000 and the Workers' Union of England to actually launch a judicial review tomorrow.
Yeah, tell us about that.
So this judicial review...
This is calling on or suggesting that it's illegal to coerce, even coerce people into vaccinations, let alone make them mandatory in any sense whatsoever. So it's looking at the government's decision and asking the courts to decide that the governments have acted outside of their powers, that they don't have the science to back it up, that they haven't got the right law to actually implement it. And it's been headed up by Dr. Steve James, who I know that you've had on here, and 8 other health professionals. And we are going to the courts to ask them to overturn this mandate for the NHS. And anybody out there who feels that it's the right thing to overturn this mandate can go to the Together Declaration now, and they can sign that petition.
that goes alongside the judicial review. So you can show your support by going there.
I think I know 90,000 people who might sign that. They work for the NHS.
Absolutely, and many more. It's you don't have to not have had a vaccine to support this. As everybody knows, I've had a vaccine, but I am absolutely 100% behind these people. This is about choice, and this is about supporting people to make their own medical decisions.
Also, I absolutely agree with you 100%. But also, aren't we at a stage in the COVID crisis, quotes crisis, where all of this, vigilance is no longer really necessary, is it? Yeah. I mean, we're at the stage now. Omicron's come along. You hear some doctors saying, "Oh, well, you don't know what other variants might come along." Now, I'm not medically qualified, don't know that much, but I think I do know that the progression of a virus is that each new variant becomes less powerful than the last one. So then any more variants that crop up after Omicron are likely to be even weaker than Omicron. And Omicron's pretty damn weak itself, isn't it? So what is this all about? Why are they calling for us to be boosted and vaccinated against a variant, a virus that now makes you ill for a couple of days and then you're okay? You don't need to be vaccinated against that, do you?
Well, we don't have a vaccine that seems to be working against it very well anyway. So, previous infection and the vaccines, Omicron seems to be able to get around it. Most people get a cold for a couple of days, and it does appear to be that weak. There is another variant at the moment, BA.2, which is another Omicron, but one bit on.
They'll have to get a better name than that.
Well, and it doesn't look any more serious than the current one, and it does seem to be quite.
Chris Whitty want to call it the super death variant.
Where is Chris Whitty?
Yeah, he's working on a new name for what's it called? .22.
BA.2. Well, Omicron is BA.1.
Okay.
So, we have to get to a point where we are living with this virus, not just existing. And at the moment we are existing because when we are still going through life with this trepidation, what might the next variant be? How can you actually just get on with life when you're worrying about tomorrow? We need to live in today, and it is time to do that.
And it's very possible that a new variant will be, or the existing vaccines, potentially could be completely ineffective against a new variant, couldn't they?
Yes.
So why are they telling us to get... Because they are telling us now to get vaccinated in case there's a new variant. How do they know the vaccine's going to work against it?
Well, I don't know who's saying that, and I just don't...
Well, I've heard doctors say
Yeah, well, I don't agree.
Heard one on Talk Radio today.
Well, I heard one on Talk Radio today, and I didn't agree with much of what he said, actually.
He's the one that wants mandatory vaccines.
Yeah, and he thinks people should be fined if they don't have it. And again, we come back to this discrimination and fighting this. We cannot have this. And I think we now need to accept that we've done all we can. We've protected our vulnerable people. Sadly, people will die of Omicron and other things. As I said last week, our daily deaths at the moment, because we're in winter, are actually lower than the 5-year average up to 2019. People do die in winter more than they do in summer. It's a sad fact of life, and it happens. We're not going to stop that. So if you think you're vulnerable and you feel unsafe and you want to carry on with social distancing, mask wearing, all of those things, that's fine. That's absolutely acceptable as well. I wouldn't discriminate against you for that either. No. So do that, but the rest of us have to be allowed to live our lives.
Just shortly before we go to the break, Renee, it was the Freedom March in London, estimates of 200,000 people marching through the capital city. Also, Manchester, Newcastle and Leeds all had significant protests. These were the people who've had enough of all the restrictions. They've had enough of us actually still acting like we're in a crisis. They just want to get back to normality. Now, here in London, a rather striking protests as a load of nurses threw their uniforms onto the ground in Trafalgar Square. Other medical staff threw their swabs and their face masks into the air. It was all very pictorial. You didn't see much about it in the press. For some reason, the media don't cover these seditious events. It doesn't fit in with government policy, I suppose. But let me ask you this. Why are there so many, or were there so many doctors and nurses at, for example, the London March? That's the one I know about. And I know there were loads of doctors and nurses there. Why?
So I think there's two reasons, really. I think on the first side of it, these are people who have chosen not to have the vaccine. They've worked at the coalface for 23 months now. They've either not got COVID in doing that, or they've just been constantly exposed, or they have got COVID and they feel that their immunity is enough for them. So they feel very strongly that they don't want to get vaccinated. They may have seen people who have had adverse reactions to the vaccine and they've made their decision that way. The other group of people are doctors and nurses who have been vaccinated, but they fully support their colleagues in making their own choice about their bodies. I'm one of those. I fully support those people.
Yeah, and let's make this clear. At all of these marches, yes, there were anti-vaxxers present, but the people we're talking about, doctors, and they're not anti-vaxxers. No. They're anti-mandatory vaxxers, if you like. So it's an important distinction.
Good talk.
Hot talk. Bold talk. Talk radio.
Listen on your smart speaker.
Watch it live on your smart TV.
The world headquarters of common sense.
Talk Radio.